Zangfu, The Organ System of Traditional Chinese Medicine by Jeremy Ross, page 188, chapter 15, Emotions. Emotions and Yin Yang. Lack of any emotion, whether from obstruction or deficiency, may be seen as yin, whereas excess of any emotion may be seen as yang. However, some emotions seem more yin or more yang than others. For example, anger is more yang and active than pensiveness, and joy may be more yang and extrovert than sorrow and anxiety. Nevertheless, each emotion has its own yin and yang aspects, which may transform into each other. Frustration may rise up as anger and fall back into depression. Fear has its more yin, passive aspects of paralysis and immobility, which may transform into its more yang aspects of flight and fight. The arbitrary division of people into deficient yin and deficient yang types, discussed on page 204, may include emotions. The thinner, deficient yin type tends to irritability, anger, restlessness, hypersensitivity, and extroversion. Wrist, the plumper, deficient yang type tends to be more phlegmatic, less active, and more introvert and prone to depression. However, this is a gross oversimplification and of use only as a most general guideline. More specifically, deficient Shen Yin, the foundation of deficient Yin of the other Zang, is associated with signs of heat and anxiety. Wrist, deficient Shen Yang, is more associated with signs of cold and depression. If yin deficiency includes deficient Shen Yin, there may be disturbance of Shen, with overexcitement and irritability. If yang deficiency includes deficient Xing Yang and deficient Xin Qi, there may be deficiency of Shen with dullness and lack of joy and vitality. If Xin is obstructed by phlegm, there may be a predominantly yin pattern, cold phlegm misting Xin, with signs more of introversion, depression, and inactivity. Or there may be a predominantly yang pattern, flame fire agitating Shin, with signs more of extroversion, violent mania, and hyperactivity. Emotions and substances. Deficiency of the substances may be arranged into two groups with respect to the emotions. Deficient Yang Group, Deficient Qi, Deficient Shen, Deficient Jing. Deficient Yin Group, Deficient Xue, Disturbance of Shen, Deficient Jin Ye. The deficient Yang group may be associated with introversion, depression, lack of joy, and general dull emotional response. And the deficient Yin group may be associated with extroversion, anxiety, mania, and general emotional excess. However, this is only a very general guideline since there is much overlap between the substances and their disharmonies, as discussed in Chapter 3, and since there are several facets to each substance. For example, in the case of Xue, there are various aspects and various factors involved, as shown in Table 15.3. Stagnation, phlegm, and internal wind are all associated with obstruction or irregularity in the flow of qi and xue, and may involve emotional disharmony of both yin and yang types. This is considered in greater detail in other chapters. Table 15.3 Disharmonies of Xue and Emotions. Formation of Xue aspects. The Zangfu disharmonies are deficient qi and yang of pi and wei, which emotional disharmonies are pensiveness and worry. Another aspect of formation of Xue, the Zangfu disharmonies are deficient Shenjing, which emotional disharmonies are fear and fright. Movement of Xue. The Zangfu disharmonies are Deficient Yang of Shen and Xin and Fei. Emotional disharmonies are fear and fright, sadness and grief. Evenness of movement of Xue. The Zangfu disharmonies is a depression of Ganqi, which emotional disharmonies are irritation, anger, frustration, and depression. Holding of Xue in Xue Mai aspect. Zangfu disharmonies are Deficient Qi and Yang of Pi, which emotional disharmonies are pensiveness and worry. Another aspect of a holding of Xue in Xue Mai, the Zangfu disharmonies are heat in Ganxue, which emotional disharmonies are anger, irritation, and frustration. Emotions and Jing Luo. Basically, Jing Luo may suffer from four main problems: deficiency of Qi and Xue, obstruction of flow of Qi and Xue, irregularity or disturbance of flow of Qi and Xue, presence of disease factor. In practice, there is often overlap between these four closely related problems. For example, obstruction in the flow of Qi and Xue may result in temporary deficiency of Qi and Xue in the front of the obstruction, and temporary excess of Qi and Xue behind it. Conversely, deficiency may give rise to stagnation of Qi and Xue. Also, obstruction may be closely linked with irregularity, disturbance, and fluctuation in the flow of substances through Jing Luo. Rebellious Qi, i.e., Qi moving in an inappropriate direction, is a particular case of irregularity of Qi flow. The fourth category of presence of disease factor may include both external and internal types of wind, cold, heat, damp and dryness, and also phlegm. Emotional disharmony may give rise to any combination of these four categories, and vice versa. Linking external factors, emotional factors, Zangfu and Jing Luo. Mental faculties and emotions. The distinction made here between the feeling or emotions and the intellectual faculties or mental abilities is rather arbitrary, since the two are inextricably interlinked. However, the Neijing associated specific intellectual faculties with certain of the Zangfu, often in terms of officials of state. Xin is sovereign ruler who directs with clear insight. Fei is a minister in charge of rhythmic order. Gan is a general who excels through his strategic planning. Whist, Dan is the official who excels through his decisions and judgment. He is a repository of imagination and ideas. Whist, Shen stores the willpower and is associated with technical skills, excelling through his ability and cleverness. Table 15.4 links the five Zang with their respective mental faculties, but there is considerable vagueness and overlap. For example, clear thinking may be linked with Shen in terms of mental skill and cleverness, with P in terms of clear manipulation and storage of ideas, with Gan in terms of the balanced expression of those ideas, and with Shin in terms of clear, directed consciousness. Table 15.4 The five Zang and mental faculties. Shen, which is Shen's faculty, is stores and governs will. His faculty is stores and governs imagination, ideas, and memory. Gan's faculty is residence of Han, soul, governs emotions, mental balance, and conduct. Shin's faculty is residence of Shen, spirit, mind, governs consciousness, clear thinking, and insight. Fei's faculty is presence of Qi, animal spirit, governs sensations and movement. Wrist, the faculties are listed. They are not given the same importance as physical or emotional factors and are rarely listed as either origins or signs of Zangfu disharmony. Clinical importance of emotional disharmony. There are two main aspects of the clinical importance of the emotions. Number one, as factors originating Zangfu disharmony. Number two, as signs of Zangfu disharmony. Chapters 7 to 11 on the five Zang give outline diagrams of the origins of disharmony of each Zang, and also give list of the signs of disharmony characteristic of each of these organ systems. In the case of Gan, anger, irritation, frustration, and depression may all contribute to the patterns of Gan disharmony. These emotions, along with hypersensitivity and the tendency to overreact to environmental stimuli, are also signs characteristic of Gan imbalance. In the case of Shen, however, excess joy is not generally listed as either a sign or an originating factor of Shen disharmony. Precipitating factors of Shen imbalance disharmony may include anxiety, mental irritation, depression, sadness, and grief. Anxiety and mental irritation may lead to disturbance of Shen, and depression, sadness, and grief may result in stagnation of Qi and Xue, perhaps with eventual production of fire and flame. The mental irritation associated with Shen is perhaps more linked with sensation of anxiety and panic than the mental irritation associated with Gan, which is perhaps more concerned with anger and irritability. Similarly, the Shen type depression is perhaps more linked with sadness and melancholy than the Gan type depression linked with frustration. However, mental irritation and depression can affect both Shin and Gan, and which is predominantly affected will depend on the predisposition of the individual and on the situation at a particular time. Indeed, both Zang may be affected by depression and irritability at the same time, so that signs of both Shin and Gan disharmony are manifested. Signs of deficient Shen may include apathy and a lack of joy, and depressive, introverted behavior, whereas signs of disturbed Shen include restlessness, anxiety, fearfulness, and irritability. Or, in extreme cases, insanity and violent behavior. Fear and fright are listed as factors that may originate Shen disorders, but are not often listed as signs of Shen disharmony. Similarly, excess thinking or preoccupied thinking, i.e., worry, may be factors in P imbalance, but are not usually listed as important signs of P disharmony. Grief is listed as neither origin or sign of Fei imbalance. Indeed, Gan and Xin are the two Zang most affected by the stagnation of Qi associated with grief. In summary, Gan and Xin are the two Zang for which emotional factors are most important in precipitating disease, but anger and joy are not the only emotions involved here. And in the case of Xin, joy may not be the only or even the main emotional signs of Xin disharmony. Fear and preoccupation may injure Shen and P respectively, but are not listed as main signs in the disharmony pattern of the organ systems. The origins and signs listed for Fei disharmony do not generally include grief. However, just because an emotion is not generally listed as an originating factor or as a sign of Zang disharmony, does not mean that it is unimportant in this context. It simply means that some Chinese texts consider other factors or signs of greater clinical relevance. Treatment of emotional disharmony. Diagnosis. treatment and patient education in cases involving emotional disharmony are according to the usual principles, and choice of points and methods of point use will depend on the situation of the particular patients. Cases involving emotional disharmony may be arbitrarily divided into two types: general cases, cases of severe mental illness. The category of general cases includes those patients where emotional disharmony is an important component of the pattern of disharmony, whether emotional disharmony is a presenting sign or not. This category includes a large proportion of all patients coming for treatment, since emotional and mental stress are involved in almost every case to some degree, as discussed elsewhere. The category of severe mental illness is represented by far fewer patients in general acupuncture practice, since patients suffering from extreme emotional and mental imbalance are often not capable of normal functioning and are confined in specialist hospitals, whereas patients in the general category may come to the surgery for treatment once a week or once a month. In the average situation, patients suffering from severe mental illness generally need to be treated in hospital or home situation on a more or less daily basis. However, in practice, there is no sharp distinction between the two categories, and indeed, a person may suffer from chronic, moderate emotional disharmony with periodic acute severe crisis, whereas acupuncture can be very effective in most general cases. Result in cases of severe mental illness can be very slow, and there may be a strong tendency to relapse. Nevertheless, research is being carried out in China on the treatment of severe mental illness by TCM, and progress is being made. Examples of cases involving general emotional disharmony are given throughout the book, and some details of severe mental illness are given in the next section. Treatment of severe mental illness. General principles. The general aim of treatment is to disperse hyperactive yang, blazing fire, stirring of internal wind and phlegm, to regulate qi, and to calm the mind and clear the brain. Since yang, fire, and wind tend to rise and obstruct the channels of the head, points on the head are important here. Points on the limbs, especially below the knees and elbows, and especially from Shen, Shin, Shinbao, and gun channels, may be used as secondary points. Reinforcing, reducing, or even method of needle manipulation may be used as appropriate, in some cases with moxa or with electrostimulation. Example of head points. Shenqing, do my 24. Calms mind and promotes clear thinking and memory. Mei Chom, bladder 3, helps disorders arising from upward disturbance of qi and hence sensory and perceptual problems. Tolinchi, gallbladder 15, apoplectic coma, emotional disturbance. Benshen, gallbladder 13, gathered qi together, preventing it from splitting up. Those 4 points all treat seizures and vertigo. Parietal Region. Holding, do my 19, disturbances of perception. Bai Hui, do my 20, disturbances of perception and movement. Qiang Jing, do my 21, excessive movement and speaking. Xuan Lu, gallbladder 5, disturbances of speech. Temporal Region. Shuai Gu, gallbladder 8, deafness and auditory hallucination. Qianchong, gallbladder 9, Disturbance of hearing. Ethan, triple burner 17, and Lucy, triple burner 19. Auditory hallucination, ringing sound in brain. Occipital region. Qi, gallbladder 20. Optic atrophy. Chu, bladder 10. Ataxia. Example of point combinations. Coma. First group. Bai Hui, do my 20. Yin Yang, MHN3. Da Ling, P7. Second group. Dan Shen, gallbladder 13. Shen Jing, do my 24. Ren Chom, do my 26. Treat every day, alternating first and second group. Dreamy state. First group. Da Chui, do my 14. Yang Ling Kuang, gallbladder 34. Second group. Shen Xue, Renmai 8. Guan Yuan, Renmai 4. If the second group is selected, mild moxa can be used. Disturbance of thinking. First group. Bai Hui, do my 20. Luo Xue, bladder 8. Tong Li, heart 5. Da Chong, kidney 4. Second group. Bai Hui, do my 20. Fen Qi, gallbladder 20. Shen Men, heart 7. Tai Shi, kidney 3. These point combinations are used where thinking is interrupted, so that, for example, the patient cannot finish a sentence. Conditions of mania and depression associated with Shen disharmony are discussed on page 112, and patterns involving violent aggressive behavior are discussed on page 133 under GAN disharmony. Example of case histories. The following two brief case histories are of patients treated in the Nanjing Mental Hospital in 1981. Number 1. An adult male, schizophrenic, had a pattern of wanting to eat his stool and urine, and of wanting to die. Treatment with Western medicine was unsatisfactory. Acupuncture using head points and Chinese herbal medicine were used, and the patient was much improved after 6-month treatment. The needles were retained for 1 hour each treatment, and the main points used were Shanxing, do my 23 through the Shanqing, do my 24. Toe Wei, stomach 8 through the Bensham, gallbladder 13. Holding, do my 19 through the Tianchong, gallbladder 9. Number 2. An adult male suffered from various fantasies. For example, he imagined himself to be the heroes of various films and thought his doctor was his father. Western medicine was used in conjunction with acupuncture, and the following points were used. Bai Hui, do my 20. Qianding, do my 21. Tou Wei, stomach 8. And Armen, Toi Purbana 21. Through Tingong, small intestine 19, to Tingwei, gallbladder 2. Summary. The interrelationship of emotions and Zangfu patterns of disharmony is of supreme clinical importance. In the West, most illness is originated by, aggravated by, or associated with emotional disturbance. Although the terminology of 7 emotions and the 5 feelings is too limited to represent properly the full range of human emotions, acupuncture treatment can help greatly in a very wide range of general cases involving emotional disharmony. In the field of severe mental illness, especially where patients are confined to home or hospital, the result of acupuncture treatment may be slower and less marked. However, research is being carried out, and at least in some cases, some degree of relief may be obtained. Usually, the patients are treated in the hospital situation every day or every other day.